This is an installment of Staying Safe in the Hospital, a guide for older adults and their families. We are here to talk to you about end of life.
Hello, I'm Dr. Amy Yu, and I'm one of the doctors at the University of Colorado's Acute Care for the Elderly Service.
And I'm Kelsey White, a nurse who works on the Acute Care of the Elderly Unit at University of Colorado Hospital.
Let me start by sharing the story of one of my patients. She was an 89-year-old woman who had come into the hospital for a urinary tract infection 2 weeks after getting the flu. She initially did well with antibiotics through the IV, but then developed bleeding from a stomach ulcer. She had a procedure where a camera was put into her stomach to see where the blood was coming from, and then had staples put in to stop the bleeding. Although her infection and bleeding were treated, over the next week, the patient began to sleep more and more and ate and drank less and less, despite family encouraging her to do so. She no longer wanted to sit up in bed, wanting instead to lay down and sleep. She also began to talk with her father and mother, who had passed a long time ago, while picking at the blankets and her gown. The patient's family was very concerned and was wondering what was going on. What the patient was experiencing were signs and symptoms that she was nearing the end of her life. Despite having her infection and the bleeding ulcer treated, her body was not able to recover from the stress of those illnesses and started to shut down. This is very common and natural as we age because our bodies just do not have the reserve they had when we were younger. After speaking with the family, we had made a shared decision to transition this patient to comfort care and focus on helping her have a peaceful and dignified death. She was too sick to leave the hospital, so we made plans to keep her comfortable in her hospital room. It can be very difficult and scary to see someone you love going through the end of their life in the hospital. We hope to review what to expect, how we care for the people at the end of life, and what families and friends can do to support their loved ones through this important stage. When death is near, the body begins to shut down, and there are changes that you may see. These changes are normal and natural. Each person is different, and not all these changes will happen, and may not happen in the same order in which we will review. Eating and drinking may slow down and stop. This is natural as the body and its organs start to shut down. It is natural to feel worried if your loved one is not eating or drinking as they used to. I want to assure you that your loved one is not starving. This is a very common concern. Your loved one's body will tell them when it needs something. Let your loved one tell you when they want food or drink, and follow their lead. You may also notice that hands and feet become cooler to the touch, and the skin may become purplish or blotchy. This is natural as the body starts to shut down. Sometimes people's arms and legs may also swell. This is also natural and is not causing pain. Warm blankets, gentle massage, and hand-holding can be sources of comfort. You may also see that your loved one is sleeping more and for longer periods of time. This is very common. Your loved one may not have as much energy as their body shuts down, and you may see that they are sleeping more and more. Even though they may not interact with you, you can still talk with them, play their favorite music, and hold their hands. You may also notice that breathing may become slower and irregular. You may notice that your loved one's breathing may even stop for several seconds, anywhere from a few seconds to 45 seconds before restarting. Their breaths may also become more shallow. These changes in breathing are another sign that the body is shutting down. You may also see drooling and/or gurgling sounds in your loved one. Drooling and gurgling sounds are common at the end of life because the mouth and throat muscles get weaker. This does not cause pain or discomfort, and there are medicines we can give to help if the sounds become bothersome or scary. Bowel movements and urination patterns may also change. As the body shuts down, pooping and peeing may slow down or become unpredictable. The nursing staff will keep your loved one clean and comfortable. A urinary catheter or tube may be used for comfort. And lastly, some people may become confused and restless. This may look like picking at things on the bed, or grasping for things in the air, or speaking to people who are not there or who have already died. Some people may also become agitated with yelling, calling out, or moving around in bed. This is often called terminal delirium and may happen when the brain is at the end of life. The best thing to do during this time is to remind your loved one they are safe. We are also able to give medications to help people calm down and rest.
When you or a loved one are at the end of life in the hospital, we focus our cares towards ensuring the goal of being comfortable is met. We purposefully stop cares such as vital signs, lab draws, and imaging tests that may cause discomfort. We may also remove lines and tubes or monitors. Instead, we focus on assessing for pain, difficulty with breathing, nausea, mood and behavior changes, proper positioning, and social and spiritual needs. This is called comfort care. An example of this type of care may be the nursing team providing humidified oxygen if the nose or mouth is dry, or removing oxygen tubes or masks if it is a cause of discomfort. We may also use a fan or changes in position to make your loved one more comfortable. Medications that we may give to treat shortness of breath or agitation can include opioids and benzodiazepines. Know that we are trained to dose these medications, and when done so, they can be very helpful without speeding up the dying process. Treatments are tailored to each person's needs and may be provided by mouth or IV or under the skin. As people become less able to respond, know that we have ways to assess pain and other symptoms without needing to ask, such as looking for frowning or how quickly someone is breathing. If someone wants to connect with their faith or belief, we can help arrange that too. The most important thing is that your loved one and you feel safe and cared for during this time. We'll work to make sure your wishes are met and that you all are as comfortable as possible. So what can family and friends do to help a loved one that is dying? A great deal. If it is okay with hospital policies, family may be able to stay at the bedside. If interested, family can work with nursing to assess a loved one's pain and comfort level and assist with cares like bathing, mouth care, position changes, and offering ice chips or sips of fluid if desired by the loved one. Family can be the most important provider for social needs. Revisiting fond memories, talking about things that bring them joy, or just being with them and holding their hand can be a source of comfort. Although the loved one may not be able to respond, familiar voices are reassuring. It may also be natural for the patient to request alone time. Let the care team know, and we are happy to provide family and friends with a comfortable waiting area.
Some people like to say goodbye to their loved one in personal ways or perform rituals that are important to their loved one's culture or religion. Please let your care team know how we can help with any needs. One thing your loved one might be worried about is how everyone will be after they're gone. Sometimes people at the end of their life may need to hear that everyone they care about will be okay. This is a great gift to offer the dying person. This is a period of time when a lot of emotions may come up. This is natural and normal. It is okay to leave the loved one's room, to use the restroom, to eat, to sleep, or even to take a moment for yourself. Lastly, some people at the end of life may need or want their loved ones with them during the time of death, while others may need or want time to themselves and will wait until loved ones have left the room. All of these are natural and normal ways to say goodbye. Many people wonder how they will know if death has occurred and what to do after. Here are some common signs that you can look for. The person cannot be awakened by voice or touch. Breathing has stopped, meaning that the chest may not move up and down. The heartbeat has stopped, meaning you may not be able to feel a pulse. Eyes may not focus or move. The eyelids may or may not be open. And lastly, the jaw is relaxed and the mouth may be slightly open. If you notice any of these signs, press the nurse call light and let staff know that you think your loved one has died. They can come to evaluate and will then notify the doctor. A doctor will come into the room, introduce themselves, and then use their stethoscope to listen to the chest for heart sounds and breath sounds. The listening may require at least 30 seconds to a minute. The doctor may also use a light to look at your loved one's eyes to check for reflexes. Once the doctor is done, they will confirm that death has occurred and give a time of death.
When a loved one passes away in the hospital, the healthcare team focuses on honoring the life that has passed and comforting the loved ones at the bedside, including your privacy. You may be asked if there are any cultural or spiritual requests. If members of your family would like private time with the deceased, and if you are interested in participating in post-mortem cares, which is the process of taking care of the person's body. If it is something you are interested in, know that approaching and touching the loved one is okay and can assist with processing and family bonding time. The doctor may offer you an autopsy exam, which can increase medical knowledge, teaching, and research. This is a personal decision, and there is no pressure to accept or decline. The nursing team will handle putting in a donor referral to determine if that is one of the person's wishes. Support team members that may come support you include social work and spiritual care. We will help you gather all the loved one's personal belongings and valuables so you can take everything special home with you. After that, in preparation for the transport team to come for your loved one and bring them to the morgue, the nursing team will be sure to cover the body with a shroud, as privacy remains of utmost importance to us. It is a good idea to begin planning for a choice of funeral home, crematory, mortuary, or whole body donation company. That is absolutely not something you're expected to know at the time of death, but you can expect a call from Decedent Affairs for your decision and assistance in helping with this next step.
We have now talked about one of the most important, yet least talked about experiences that may happen to older adults in the hospital, end of life. What it is, what to expect, what we do to support the dying person and families, and what families and friends can do to support the loved one through this phase. Thank you.